Okay, we're here with Jack. Jack is injecting his left knee. Actually, Philip's going to inject Jack's left knee. We're not going to let Jack do it himself.
Alright, so we're going to make a little mark.
He's marking the landmarks on the knee to make sure he's getting it into the joint space. On every one of these, we've done an exam. He's done x-rays, so we know what the joint structure itself looks like. Some folks will have MRIs, some don't. So he's injecting. The first part is some pain reliever.
Gonna feel a poke. Here comes some medicine.
What do you feel, Jack?
Actually, nothing. I felt a little poke and
Any pressure in the knee?
not on this one.
He's had a couple other body regions injected today.
Here comes the product.
I didn't hurt at all.
That's it.
All done?
Wow.
No tears. I like it.